Learning more about the Butte-Glenn Sexual Assault Response Team's 2026 report on sexual violence. That report covers 2022 to 2024. And Action News Now reporter Sade Poulin has been looking into this today and brings us now a closer look at what is really driving these numbers, Sade.
Yeah, so I spoke with a forensic nurse examiner with Enloe Health, and she said that 95% of victims were female. Now, Jacqueline Winters Hall, a forensic nurse, tells me that a forensic exam is done to document injuries, provide medical care, and collect evidence following a sexual assault or domestic and child abuse. Winter Hall tells me that between January 2022 and December 2024, 245 forensic medical exams were conducted for people aged 7 months to 82 years old. According to the Sexual Assault Response Team, or SART for short, 68% of their victims knew their assailant, but Winter Hall says we need to look at the bigger picture of what these numbers can tell us.
Yes, our numbers are, unfortunately, our numbers are going up. That doesn't really reflect an increase in sexual assaults in our region. I think the numbers are trending up because people are feeling more safe coming to the hospital. They're actually returning to pre-pandemic levels. Before the pandemic, we were in the 80s, 90s, and now our numbers are trending back up. And I think it's because people are feeling more and more safe coming to the hospital.
Winter Hall says the report also revealed that 16% of victims reported unstable housing, such as couch surfing or being in a shelter. 13% also had a disability. Hall says that the forensic nurses handle each disability carefully and they adjust the needs for every patient. Winter Hall says if a minor is assaulted and wants an exam, they need parent or guardian approval. Winter Hall says you can get a forensic exam up to 10 days after the assault, even if you've showered. Winter Hall says as a community, we can lessen the amount of sexual assaults through education at home and at schools. Winter Hall says the more evidence we have on assailants, the more police have to work with to prevent this person from striking again. She also says if bystanders see an assault, to do something to stop it or to contact the police.
Now, you mentioned Winters Hall there. She is associated with Enloe. Does Enloe work with any other agencies in this?
Yes, they do actually. So they work with the Oroville Hospital as well. They work with law enforcement, and they also work with Catalyst, the domestic violence services, along with other partners. So while the report covers incidents in Butte and Glenn County, all the patient reports were taken at two major hospitals to handle these cases, which is Enloe and Oroville, since Glenn Medical Center does not have a forensic exam team.
Did she tell you what's the age group that might be most targeted, is what the report shows?
So the report showed that the most targeted ages were between the ages of 19 to 24, which is typically the college age.